one of the things that I didn't have access to in the first half of my career was a diode laser. And so gum reshaping is something that I think about in any cosmetic case that I do, because a lot of times you can get the teeth just right, but if the gums aren't just right, then it looks off, it looks canted, or this tooth looks too long. Well, they're the same length, but this tooth may have recession and this tooth may not. So the laser allows me to do a lot of things that would be difficult to do, but with sometimes just a topical gel anesthesia, I can reshape the gums to really, a minor adjustment to a gum line can be a transformational effect. Some people, all the cosmetic dentistry they really need is a little bleach and a little gum reshaping, and then all of a sudden that chief concern is resolved, and that's really inexpensive. There's not a whole lot of recovery time. We're not talking about old school scalpels and stitches. It's something that when we call on care calls the next day, they feel nothing. Everything is already healed, because that's what the laser is designed to do. Treat the area and heal as it removes tissue. So that's something that, and it's not something I was trained on initially in dentistry, but it's a resource that I couldn't practice without now, because it's just so beneficial in so many different situations. Sometimes the laser we use for like a fibroma or something that, something that just needs to be excised and sent for a biopsy, something that's concerning or something that's just annoying. It's just a callus that's been built up over time. If you do that the traditional way, the healing, the discomfort, it's a completely different story versus a laser where, like I said, the healing response is instantaneous. There's no bleeding, there's no post-operative discomfort. So to be able to provide those things in a way that's, especially when you take like a teenage girl who gums may be inflamed because of orthodontics, and if you think about going any other route than shaping that with a laser, it's unsightly, they're puffy, they're teenage girls, so they're in tune with how they look. And if you do that any other way, it's not a pretty outcome, but you can provide that, and really the patient it's kind of like nothing ever happened other than you see the results.